In the world of breast augmentation surgery, there are lots of different ways of determining what it is that the patient's desiring as far as the final outcome. There are some surgeons who just basically go off of measurements, and there's a lot of utility to that in the sense that they measure how wide the chest is, and from there they'll estimate or determine the size of the implant that the body can handle. There definitely is a specific size that is particular for a body frame. A lot of times I do find, though, that that particular size that fits that patient's frame is not necessarily the look that they're going for. So if the implant is appropriately shaped for the body, generally the complication rate and the need for revision surgery goes down substantially. Once we start increasing the size of the implant, essentially making the implant a little bit bigger for the body than what standard measurements would dictate, we find that revisions increase. However, one of the challenges we have is that oftentimes patients want a specific look, and that look doesn't necessarily match just based on measurements. So in my practice, that's where pictures play an important part. It gives me more of an objective view of what it is that the patient's looking for versus subjective. And from there, I can help guide or educate the patient on, yeah, this size is perfect, or no, hey, we can go with this size. It might be a little bit increased risk of some of the complications or revisions, or worst case scenario, hey, listen, this implant is way too big for your body.